In that therapy, what you do is you actually have the patient come in for a blood draw. Then you take that blood, you spin it down, and then you actually harvest very specifically the platelets of the person's blood. Platelets are basically little cells that help you stop bleeding. So, for example, if you were to cut yourself, platelets will come and form little aggregate tissues to help you stop bleeding. What we've noticed is that those platelets are also very good at plugging up damaged tissue. So how I explain it is basically when a tissue is starting to degenerate, it starts creating little tears or little holes. So what you're doing is when you inject those platelets into the area of damage, you're actually plugging up those little holes so that the tissue becomes whole again. So the beauty of this therapy, again, is you don't need to worry about the body recruiting healing properties to that area. You're actually injecting the substance that will actually start forming those plugs.
And so what are the results you're seeing with this therapy?
Yeah, so there are lots of different great results that we're seeing. Again, whether it's a tear in the meniscus or an ACL tear, a bulging disc in the back, a torn rotator cuff, you can see those tissues heal over time because of the ability of these modalities to really come in and do the regenerative therapy that needs to be done to heal that joint space. So, people, whether that, again, is acute injury where they tear a ligament, or it's a chronic overuse injury where, golfer, a football player or whatever, and they're constantly degenerating a joint space or what have you, you can heal those chronic degenerative states or heal those acute issues with these types of injection therapies.
So if you have a tear in your meniscus in your knee, for example, knee arthroscopy generally tends to be the treatment of choice in the Western world, and they go in there and they basically take that tear out. So they're, chipping away at your meniscus.
Right.
So what you're telling me is that with this therapy, it will actually regenerate the tissue at the tear site.
Yeah, so that is another conversation in terms of when a patient comes in, we have to really understand the grade of the tear as well. So a complete rupture, meaning, if you're ACL or there's a complete rupture in a ligament or tendon, those types of things, there usually is surgery involved in that. And we talked about earlier, there is a time and place for that. So there's a time and place for those two different, the Western world and then the natural world, and trying to bring healing to the body. So what we would do if there was a complete tear, let's say, we would actually do injections prior to surgery to prep the joint for surgery and make sure that the surgery goes even better. And then we treat them after to make sure that the tissues are healing correctly and that the tissue attachments are solid so that we can improve outcomes with surgery as well. So, whether, again, that's a complete issue where surgery is needed, or if it's a minor tear or a partially torn ligament, ligament tissue, those types of things, we can be of service in healing those damaged tissues.
Oh, so I love that collaborative piece, right? Like that just, to me, is a marriage of complete healing. Like that's where you get it, especially if you have something where you need surgery.
Exactly.
I mean, that makes perfect sense.
Yeah.